I've been struggling with losing weight, gaining weight, the whole yo-yo diet, pretty much my entire life. And I got some lab work back and it wasn't so good. And I was on my second blood pressure medicine was just prescribed. And I was like, my labs aren't good. I'm on another blood pressure medicine now. I need to make some changes. This is bad. I started seeing ads and emails sent to my MUSC account about the weight management center, and I looked it up and it said it was the #1 weight loss management center in South Carolina for a number of years. So then I started looking at the success stories and then the plans that they had, and I thought it worked really well for me because I liked that they not only focused on food, but they focused on exercise habits and behavioral, because it's not, losing weight isn't just about decreasing your calories and exercising more, it's mental as well.
One of the things that makes us unique is that you do see all the different disciplines. And so you see dietitians, exercise physiologists, and psychologists, because we all know eat less, exercise more, but the behavioral component really kind of puts the pieces together so that it's more sustainable for the long term. And really when I talk to patients or clients and see what they're interested in, I look at how much they're wanting to lose, but also how much accountability do they want? Do they just need somebody to help them get started, or do they really need a little bit more hand-holding and guidance throughout the entire process?
They had just a contact us link that you clicked, and they wound up calling me, I think the same day they called me to set up an appointment. And you had the option of a virtual appointment or in-person appointment.
Individuals can come to us and they meet one-on-one with a person to help them guide them to the program that's the most important. And I think, like I said, the biggest piece is that it's not just the diet and the exercise, it's a lot of the behavioral change, which honestly is like the nuts and bolts of our programs. It's what helps everyone be able to sustain what they're doing throughout the program, and then hopefully even when they end.
The changes have been fantastic. I meal prep breakfast, lunch, and dinner, snacks in between, and it's all in the refrigerator, so you just grab it and go, which makes it super simple. I exercise 5 times a week now. I do my Peloton workouts. We walk the dog, a mile a day, which is something I committed to with the exercise specialist at the program. And I just increased that, and I started adding in yoga and strength training and things I never thought that I could do before, but now I'm doing them and I have the energy to do them. And one of the benefits, my lab work is now perfect. Nothing is abnormal anymore. I got rid of one of my blood pressure medicines entirely, the one that they had added on, gone. And my my now only blood pressure medicine was cut in half already.
Sydney, for example, did a 27-week-long program. So she actually did shakes and bars, which are incorporated into our programs, and just one food-based meal for the first 20 weeks, and then gradually transitioned onto a regular food-based plan, where then we're really working on bringing in specific food choices for the person.
This summer, I did a challenge. It was riding 250 miles for Stop Soldier Suicide. And a year ago, I would never have been able to ride 250 miles on a bike in a month. Like, that would never have happened, but it was doable and I did it. And I raised money for that benefit as well, but that's one of my biggest bragging moments, was I was able to do this when a year ago, there was no way I would have been able to do that.